Solving childbirth complications. The solution is Mahmee. In the USA, the number of births was 3.7 million, and the birth rate was 11.6 per 1,000 population according to National Center for Health Statistics. However, Black women are more likely to die from childbirth complications in the United States. The Black maternal health crisis has been an ever-growing issue within our country. According to a report released by the National Partnership for Women and Families, African American women in the U.S. are more likely to die from pregnancy and childbirth than women of any other race. Further research revealed that Black women are more likely to experience preventable maternal death than white women. Black women in the United States experience unacceptably poor maternal health outcomes, including disproportionately high rates of maternal death related to pregnancy or childbirth. Too many Black women are dying in pregnancy and childbirth. Black women in the United States are more likely to die from pregnancy or childbirth than women of any other race. Many pregnancy and childbirth complications, such as preeclampsia, eclampsia, placental abruption, placenta previa, and postpartum hemorrhage, are more likely to be fatal for Black women than for white women in the U.S. Black women are 3 times more likely to have fibroids, benign tumors that grow in the uterus and can contribute to postpartum hemorrhaging, than white women, and they occur at younger ages and grow more quickly in Black women. Black serving hospitals provide lower quality maternity care. 75% of Black women give birth at hospitals that serve predominantly Black populations. While poverty and limited access to care contribute to maternal health disparities, growing evidence suggests that Black serving hospitals typically found in disadvantaged neighborhoods provide lower quality care and have worse maternal health outcomes than non-Black serving hospitals. Black serving hospitals have higher rates of maternal complications than non-Black serving hospitals and perform worse on 12 of 15 birth outcomes, including trauma, non-elective cesarean birth, and maternal mortality. Black women who give birth at Black serving hospitals are more likely to have serious complications, including higher rates of infection and emergency hysterectomies. One estimate found that Black women's maternal morbidity rate would fall by 50% if they gave birth at predominantly white serving hospitals. Moms and babies are falling through the cracks of our fragmented healthcare system. Preventable issues are not being caught fast enough because patient data is siloed, making collaboration across specialties difficult. The solution that was created by an African American founder who also experienced those issues created Mahmee. Mahmee is the glue that connects the maternal and infant health care ecosystem together and fills in the gaps in care. Mahmee delivers data-driven care coordination and personalized support to new moms everywhere. What does Mahmee do? Mahmee gives practitioners the HIPAA-compliant tools to easily refer patients, share up-to-date health information, and collaborate with each other on patient care. The platform addresses the medical professional and gives them the ability to connect. They get to enhance their professional network by connecting with practitioners, researchers, and other specialists nationwide, so they can refer the appropriate professional to their patient. It allows them to refer with ease. As you can see, they have 4 types of users the platform can be used by. The first 2 are physicians and hospitals and health systems. The second and third are health plans and moms. The health plan user is very interesting because Mahmee is making value-based bundled care programs in maternity and pediatrics a reality for health plans. We link in network physicians and out-of-network ancillary care providers across a region so that bundled care programs can be effectively implemented for a maternity population. With Mahmee, health plans can bundle lactation, nutrition, and mental health support services for new mothers and substantially reduce costs across a population. Mahmee is a soft technology innovation under remote care. It has introduced a new model of organizational changes by providing an online infrastructure for physicians to use and refer in order to track a pregnant patient or new mother's healthcare organizational changes. They have also included a new way to structure payment and reimbursement for maternity care services in the US. Thus, they have reinvented the business model by providing a value chain. Mahmee's stakeholders include operational complexity such as hospitals, doctors, pregnant patients, etc. Mahmee is becoming an example of a successful adoption in healthcare innovations because it has succeeded on the interactions between The innovation local actors involved, such as doctors, hospitals, new moms, etc. This stakeholder concept is presented by Greenhill et al. 2004, Robert et al. 2009. Features of remote care make its implementation within mainstream care services challenging. The technology and the context for implementation is complex. Multiple stakeholders, lack of integration between them. It is very important to identify and understand the different perspectives of stakeholders as early as possible, and that is what Mahmee has accomplished. This company can also be considered a disruptive innovation. Characteristics of disruptive innovation include pace of technological improvement in a given product eventually almost always exceeds the needs of most customers. Disruptive innovation brings to the market a more affordable and simpler to use product or service. Mahmee's features and business model are simple to use and implement within the maternal health sector. It may allow insurgent companies to invade established markets and displace the incumbent. Can Mahmee be considered an open innovation? Mahmee is an open innovation. It means the combination of internal and external ideas and internal and external paths to market to advance the development of new technologies. Open innovation rejects the assumption that innovation only stems from an organization's internal R&D capacity. In 2007, Van Hippel said open innovation democratizes innovation. With Mahmee, users are active in the innovation process. Users are the developers of many/most new products, which is true for Mahmee as the founder started the company with no technical or medical background. Mahmee demonstrates that users represent needs that foreshadow general demand in the marketplace. Beyoncé and Serena Williams spoke openly about their experience being pregnant as black women. Beyoncé mentioned that she suffered from preeclampsia and had major surgery. They both said they had a lot of medical issues giving birth. Serena noted that she could have died because doctors weren't taking her symptoms seriously. With her experience, she invested in Mahmee, believing it is the solution to solve the childbirth complications gap in black women in the US. We have yet to see evidence of Mahmee is actually reducing childbirth complications within women yet. There is no data available as of this date confirming its success yet.